biggest aspect with the shin splints or medial tibial stress syndrome is that there is exercises to be done on your own. One of the main exercises we like to give is a flexor digitorum strengthening. So this is going to go on the toes. We'll separate out and do the big toe on its own. So we have a piece of THERABAND up underneath her heel. She's sitting on it. We then have her lift, and she's got to push with her toes down into that band. So if this needs to be a wider piece, we've got to have a wider piece. I don't have any. Maybe. The THERABAND is up underneath the heel. It comes up and it is supporting the small toes. She's lifting this up and putting tension on the band, and then using those toes to strengthen the foot, the flexor digitorum muscles, which are on the backside of the calf itself. We'll take that off and go big toe only. These toes will all stay down, and use that to compress. This is nice because you can work on the stretch aspect of the tissue, or the shortening phase as it's coming up, and the contracting of the big toe muscles, the what's it called, flexor hallucis muscles, as it's going down. One of the exercises, we'll just tag the video in here, is really not an exercise. It is the use of the yoga toes or the correct toes for the splaying out of the toe, so they actually have that lengthening of the intrinsic muscles of the foot. That is something that you can easily be done on your own at home while you're just passively walking around, while you're sitting watching TV. Again, we'll tag that video so you can use that and see that video. Okay, so these are to be done on a set schedule of at least every other day, with this rep and set count that we talked about. And one stretch or one take-home strengthening exercise is to bring your leg up into like a figure four while you're sitting, and you're going to grab your toes and really stretch out this tissue here by pulling back on it. Perfect. So that is a stretch aspect of it. For the strengthening, we get into things such as using a band again, or calf raises, heel raises, toe raises, things like that. This is meant to help stretch out this tissue. This can be done as a warm-up for running. It's a pretty passive warm-up routine. The next position or warm-up the patient is to do is a child's pose position like this, where the toes are flat. She is resting her hips and her pelvis on the heels, and this is meant to really stretch out this tissue here as well. With this setup, again, this is a passive thing. We worry about the passive prior to worrying about the active stuff with the strengthening and the exercises like that.